Hey, it's Dr. V, Favorite Psych NP. Welcome back. Thanks for checking out this video. Today I'm going to talk about my story as a person that came over here to the US and started at a vitamin company and is now a psychiatric nurse practitioner with their own private practice. So I think looking back as to what I wanted to do career-wise, and this is kind of prevalent for the young generations right now that are about to graduate. I wasn't sure. I wanted to be an engineer, civil engineer, then mechanical, then electrical. I was really fascinated by moving parts and calibrations and electricity. So I really was interested in that. Then I had an experience where I wasn't the happiest with my teeth, and I had, struggles, financial struggles growing up with, my family that we couldn't get braces early enough when I wanted them, when you usually get them around 13, 14. Had to get them a little later in life. And I remember how much, I valued the orthodontist for making me happy and giving me a great smile, and also my parents that, had to make payments on the braces that I was getting. Anyway, that really changed my mind about being an electrical engineer, a civil engineer. It made me want to help people and bring that joy, especially in my situation, how my parents, struggled. We had to shop around with orthodontists, depending on the prices and the treatments and stuff. So I thought, well, whenever I go to school, I'm just gonna offer low discounted rates. Like I'm still gonna have a lot of clients because I'm gonna, offer great service and low rates. And that's kind of what started driving me into healthcare. Around this time, I'd say I was 15, 15 and a half, and I had landed my first summer job. My dad had been in the vitamin business, tablets, capsules, lotions, drinks, soft gels, and he was able to give me my first job. And my first summer job wasn't making all that stuff, it was actually washing all the parts for the machines that made all the capsules, vitamins, etc. And I really started to get fascinated with how this whole place had a variety of different medications that, I thought they were medications and capsules, and all of them had a different color, different smell, and they functioned differently. And later on, when I would see the bottles, I'd say, wow, like this is pretty promising. I wonder if it really can do all these great things that it says because they're pretty low cost. So, anyways, that's when I started to think about health even more and started to, kind of see this as a future for myself. I do really have to be honest that there was a two-piece component where I really wanted to start from the bottom and see where I wanted to go with medicine. And then another part of me too wanted to be financially independent and not have my parents, still supporting me while I was going through med school. So that's when I got the great idea of becoming a nurse. And I thought, okay, I'll become a nurse and then I'll be able to pull myself through med school on my own, financially, living independent, working shifts as a nurse, and then doing med school. That's what I was thinking. So then I took the next step, which to me was starting from the bottom and learning this. And I started as a CNA. So I was working at the vitamin company. I was in high school and I was taking CNA classes, and that was in my senior year. So I was very busy to say the least. And at that time, I had to also stop playing soccer as competitively or take it as serious as I used to. And it was more because I wanted to pursue those educational goals. So I think once I became a CNA and I passed my test, because it's a written test, and then you have to perform physical exams. So I had to take someone's blood pressure. I had to clean a fake pair of dentures, and then I also had to prepare someone for changing them properly when they had a left-sided stroke. So, I felt pretty confident. I got my certification, and I started working at a nurse. So once I started working at a nursing home as a CNA, I started brand new, and I worked the evening shift. So I worked 2 to 10 p.m., which I thought was a great schedule because I could, essentially go in late. I would never really have to be late. I could have my whole morning and then I could get out at 10 p.m. and potentially still have a few hours before, I had to go to sleep. I didn't have any kids, no responsibilities like that. So it was a great schedule. And that's why I was also able to start nursing school at the same time. So after being a CNA for about 2 years, I started nursing school. Now, being a CNA to me taught me all the basics: how to talk to people, how to take a blood pressure, how to change someone, how to feed someone, and just the basic things to look at when someone appears off, changes in their presentation, changes in their baseline, when they're not themselves. And I was really able to observe those changes. Some were acute, some were slow, chronic changes where I would see decline. There was many times where the nurse that was on the staff, usually it would be 1 to 15 ratio for the nurse, but oftentimes it'd be 1 to 20, 1 to 25, depending on staffing levels. There was certain wings that were long term that were 1 to 30, one RN or one LPN, excuse me, to 30 residents, and there'd often be two CNAs during the daytime, and then in the evening and nighttime there would be one, or one of them would go home. So it was very stressful, very overwhelming, and it was go go go. And this is where I really appreciated type of work that I did. It was really rewarding to be able to shave people, feed people, and the families and the residents just be very thankful that someone was there to do that. And I really felt like I could do this and go on to the next level. So the nursing program that I had gotten into was a 2-year nursing program. It was an associate's level program where the first year you could test. After completing the first year of curriculum, you could test for your LPN, or in some places in the US they call it LVN, but basically it's a licensed practical nurse. A few things you can't do, that only RNs can do, such as the initial assessment and IV push medications, and some other things that are can be state specific. So I became a LPN, and I was very excited to start working as a LPN because I had been there working at the nursing home for approximately 3 years at that time as a CNA. So you bet I was ready to get that raise and kind of see that life that I was going to do now, because most of the nurses that were there would just pass out meds and then sit down, which would irritate us a lot. Once I started as an LPN at the nursing home, it was extremely overwhelming with all the charting, all the meds, all the timelines, all the assessments that had to be done. It was very overwhelming, and I could see why the nurses would just do what they needed to do physically with the meds or assessment or follow up or do a wound change, and then sit down and chart, because it was approximately 15 to 30 residents that you were assigned to. And that's when you really start to appreciate all these things, and you really get to see and experience the different levels of delegation and the different levels of priority. And that's why I really share that it's critical to really do the basic jobs before going on to a higher level. Not to say that this is the only way. This is just my best recommendation if someone was to ask me. And I do have to be clear that this was back in 2011, 2012, where the healthcare environment, the work environment was very different. It was post recession, things were on the up and up. And, the city that I was growing up in was growing exponentially. And that may not be the case now in 2025, where, the pay and the hours and the staffing for a CNA job may not be worth it, and you may have the option to just go directly and get your bachelor's and start working directly in the hospital as a bachelor's nurse. So I do understand that. So once I obtained my LPN, I had the certificate, I had the license, and I still had a year left of RN school. Keep in mind, the nursing school program that I was doing was a 2-year program where halfway you could get your LPN, which I did, and then the following year you could test for your RN and start, practicing. So that was my plan, to stop working as a CNA and start working as an LPN and just work that year till I get my RN. That was my plan. However, when I got my LPN certificate, I had applied all over to different nursing homes, different agencies, all kinds of places. And one of those places happened to be the local private prison of where I was growing up at. And they happened to be paying the most. And at the time, I had a child on the way. So it was kind of a perfect storm where I was kind of overwhelmed in the nursing home. And it was definitely not a place I should have started as a new grad LPN, with so many residents, so many responsibilities, and being short staffed, that I made the switch to working as an LPN at a state prison that was a private prison here in the state of Arizona. And from my first day when I started there, I was immediately hooked. Back up a little bit. At the nursing home, I was making approximately $19 an hour as a LPN, and this was daytime 12-hour shifts. At the prison, they offered me $24 to start, and the job was completely different. I was just going to pass out medications, help out with insulin, and respond to emergencies. So I was like, oh, bet I could do that. So basically, in my head, I thought, oh, it's going to be a lot less work. It's going to be predictable, pretty easy, and I'm going to make more money. So there's really not a lot of negatives, and I'm just gonna do it for a little bit. Once I graduate with my RN, I'll go to the hospital. I'll be good. So once you start in prison, you have to go through a week of orientation with all the other disciplines. So all the other correctional officers, all the food staff, all the administrative staff like that do the mail, that um, do all of the accounting. You have to do classes with all of them. So I did a week of classes, and then after that, I was able to start my on the job training. First day on the job training, working at this private state prison as an LPN. I'll never forget it. It was the day I got hooked into prison and maybe adrenaline, because there was an emergency within like 30 minutes of me starting my shift. And it was a gentleman in segregation that was having a seizure. So they just said, let's go. They grabbed the gurney. This was an automatic gurney, and it had an emergency bag, and it had some oxygen, and I can't remember, a backboard maybe. And we took off. So I was pushing the gurney, and there was like two other nurses, and we were and some officers escorting us to um, segregation. So that was an adrenaline rush in itself. Before we get there, the nurses knew who the inmate was, and they already had a plan of action. And they said that he had already done this before. But the gentleman had was a type 1 diabetic, and he had lowered his blood sugar because of some dispute he had with the officers. He wanted to go to medical. They said no. So he worked out on purpose and didn't eat to lower his blood sugar to cause a medical emergency. By the time we got there, he was actively seizing. We gave him some glucagon. His sugar, I can't remember the exact number, but it was extremely low. We put him on the gurney, and we took him back to medical, where they put an IV in him and pushed more glucose, dextrose, and basically a whole bunch of sugar to get his levels up. And I thought this gentleman was going to expire. Um, 911 had come, and by the time 911 had come, he was stable and he was awake, but we still had to send him out because of the unknown amount of time that he seized. So that was my very first day, and I thought, dang, like I really like this. And what I ended up doing there as a LPN was really doing the pill call. Like there would be so for pill call, there would be a long line of inmates that they would come after breakfast, after lunch, or after dinner, and they would get in this line and get their medication. So they had a pretty good process. And the other piece of my job was going down to segregation to do sick call. So all of the segregated inmates typically can't leave the unit unless it's an emergency or unless it's something planned. So we go to them. So I would take my scale, my blood pressure card, and everything that I would need to go over there. We would have little rooms to do the assessments. And it would be anything from a skin infection, headache, a broken finger, toe from doing exercise and rec, to stomach aches, all kinds of things. And then as a LPN, I couldn't have that initial assessment signed off because of legal reasons. So I would give it to the RN to look over and sign off. So that's how we worked around that. And I just became even more fascinated in medicine. And I started to see this pattern in people that had mental illness and how they were just so different from the other people and would often get victimized or double stigmatized. So working there really went quick. I learned a lot. I grew. I made really great connections with nurses that were experienced and that were really just there to retire. And the prison that I was at was ran so smoothly and everything was great. It was like a paradise that no one wanted to leave. So when I got my RN, no, there was no spot for me. So I had to transfer out to another prison, same company, but I couldn't stay because that's how well organized and everything was at that prison. And there's a little bit of everything in detention. Overall, you see a lot of the same things that you would see anywhere else: headaches, stomach aches, seizures, diabetes, all the things. However, the difference here was that people would come from out of the country sometimes directly into that facility. And in some countries, there's no preventative action for TB or tuberculosis. So I have worked with active tuberculosis cases because you might be thinking, well, I thought your plan was to go into the hospital once you got your RN. That was my plan, and the places that I had applied to, unfortunately, they weren't paying a significant amount, and I had to make that tough financial decision. And also, I really enjoyed working in the prison, and I thought, oh, even better, I'm gonna get to go work at the detention center where I can speak Spanish, and I'm going to be able to help out people. So that's how it kind of worked out. I think the interesting piece about working in a detention center was that you get all the regular bumps, boo boos, belly aches, headaches, people that need insulin that are diabetic, people with seizures, chronic care issues. But what you don't get is TB or active TB. That's very rare because in the United States it's pretty well controlled. However, in other countries that people would come directly from those countries to the United States, sometimes they'd get missed and they would have active TB. So this is where I developed that knowledge, collecting the sputums, knowing what ripe treatment was, what type of antibiotics for how long. So that was very unique to that specific area. That specific detention center also had a 15-bed infirmary where they had people that needed to be in the hospital but were dangerous, or it was going to be too costly or too much of a public risk to have them out in the community hospital. So they had a 15-bed infirmary, and it was like a mini hospital. And even there, you get to do everything: hang IVs, do wound care, wound vacs, have people that are elderly, people with dementia. It's a population that is intertwined and mixed. They can even have females in there, except they're isolated. That sounds pretty bad, but they are isolated where they can't mix with the male population. Primarily, it's 15 beds for males, and then they have two rooms that are, for higher custody inmates that can't mix with population, or females, so they can be, have their own private space. I quickly learned and grew and really became a subject expert in the prison. I enjoyed it and I never got bored. It was a little bit of everything. And that's when I decided to pursue my bachelor's degree. So I pursued my bachelor's degree for the administrative side and the clinical side. I thought that long term I wanted to be a nurse practitioner. And I also thought in the meantime, I will pursue the corporate ladder in this private prison. And I obtained my BSN. I went to Grand Canyon University. It was 100% online. And after I graduated with that, I felt that I had a better way to critically think and understand complex issues and really have a seat at the table. Um, when talking about current events. I felt like my nursing program initially was more on the clinical side, and I didn't focus on the big picture of hospitals, how they work, and healthcare systems, and how if a quality infection control program is not implemented, it can cost um, the people that can get an infection, but it can also cost the hospital because they're not going to get reimbursed for all that care. So it's really more complex thinking that I thought, okay, I can apply this to the prison. And sure as shit, I did. I got the next position up, which was a clinical supervisor, and I transferred to a different state prison where I managed a 2,000 bed population as the DON, and I had a team of approximately 40 staff, medical staff, working under me, approximately 20 nurses, and then the rest were ancillary staff. So that's where I grew the most. And you talk about challenging, complex issues from staff shortages, implementing registry staff, covering, developing protocols that are, current, because a lot of the protocols were older, improving quality of care, grievances, all kinds of things that just pop up and really gave me a little taste of absolutely everything in healthcare in this complex picture. During that time, I would assist a lot of the physicians there, a lot of the psychiatrists, because I was one of the few Spanish speaking nurses there. And that's where I even got more in depth one on one with psychiatry. There was a psychiatrist who I often translated for, and I began to ask him a lot of questions and just became even more fascinated with his role and how to really tell apart people from, you know, that are drug seeking versus true core illness. And I just was really fascinated in this complex picture. And that's what really, prompted me to move into mental health. I felt like it was a culmination of being a CNA, um, then an LPN, and then an RN, and seeing this in all levels and how it affected people. I really didn't mention that when I was a CNA, there was one year where I was working at a lockdown kind of like memory unit, except there was all kinds of different presentations there: schizophrenia, Alzheimer's, Huntington's disease, bipolar, psychotic people. And it was older people that were geriatric that they really had no place to go and their family couldn't keep them. So it was complex, and that's where I really started to see mental illness and what it could do to people. I do have to be honest too, there was a part of me that enjoyed the lifestyle, because when I would translate for the psychiatrist, oftentimes he would be at home and I would be there on site coordinating the care. And I thought, wow, he is able to do this work from wherever. I don't even know if he's in Arizona right now, but he's able to, see these patients and prescribe them meds and doesn't need to do anything physically. So I thought, wow, I could really do this job. And from my experience, this is what I want to do. So at that time, I decided to apply to DNP school, and I had a few choices of applying to NP school or DNP school, and I applied to both. I got accepted into both, and I chose a DNP program. I really thought about it in the sense of how they used to say that you needed a bachelor's to work in the hospital, and that was going to be the standard come 2020 or 2030. So I really had that in the back of my mind. And then I also thought I want a terminal degree where I don't ever want to go back to school again. I just want to start working, start practicing. And then the final piece of choosing a DNP was being able to educate future nurse practitioners, future nurses, and really to be able to establish myself in the academia community, to be current, to know what's going on, to be involved in new clinical research and trials and psychedelics and oxytocin for autism, all the things. And lastly, to be able to provide a discounted rate for my children to go to school. I'm still going to do that once I practice for at least 10 years. So, the overall message of this video was to kind of share a little bit of my background. I know that I'm potentially missing a few pieces, and I would love to explain in detail specifics for every single job. But again, at the core, I want you to know that you don't have to follow this path. Whatever path you follow, and how you get to that end goal is going to be completely up to you, your resources, the timing, all the things. So just know that the fact that you continue to want to help people and get that higher level of knowledge to help even more people is enough. Be responsible. Take care. If you have any questions or you enjoyed this video or want me to elaborate on something further, leave your comments down below. See you on the next one.